So this is Alyssa Nitschke. This is my presentation on electronic prescribing. So first of all, just looking at some of the benefits of e-prescribing. So patient safety is obviously a really big one. So in the United States annually, there's about 1.5 million adverse drug events. So in looking that into like a monetary value, that's about $3.5 million in healthcare spending due to these adverse drug events. So e-prescribing really allows providers to utilize the 5 rights of medication administration. So making sure it's the right patient. So there's at least two identifiers in the electronic medical record to ensure that this is the correct patient chart. So there's a picture, there's the date of birth, and then each patient has their own electronic number that's assigned to them to make sure it's the right patient. So the right drug. So there is a way to associate a diagnosis with the medication, which really helps the pharmacist to ensure that this is the right drug for what they're intending. It also allows the providers to access formularies, which really helps the provider make sure that it's a cost-effective option for the patient and for the institution. The provider also has full access to the patient's medical records, so it will alert them of any drug allergies or drug interactions with any new medications as they're prescribing. The right time, so they can just enter into their chart when they would like them to take the medication, and then anyone can very easily go in and see at what time they're supposed to be taking their medications. The right dose, so these softwares, they're equipped with kind of what they're called hard stops if the dose is incorrect. So the weight-based doses, they will take into account the patient's weight as long as it's entered in the system, and then it will alert the provider before they're able to sign their orders that the dose is not correct. The right route, so the provider, when they are entering these orders, they're given the options to choose from, and then each route is linked to the appropriate dosing. So it just kind of helps. It's another check just to make sure that they're ordering the right route. And the pharmacists do still verify the orders to ensure the 5 rights of administration are being honored. And interestingly, this electronic ordering saves pharmacists from 150 million calls made per year due to indecipherable orders. So a case study, so this is just an example of why kind of problems that e-prescribing can help prevent. So this particular case, so it was a 73-year-old male who had a history of cardiac arrhythmia. He was at his clinic just for his routine physical exam. His physician wrote a prescription for Rhythmol. He'd been taking for the past 3 years an antiarrhythmic drug. He had the prescription filled at that pharmacy. And then after that, he began having nausea, diaphoresis, irregular heartbeat. So then they discovered that the pharmacy had actually filled Synthroid instead of the prescribed Rhythmol. So they attributed these symptoms to because he abruptly stopped taking the Rhythmol he'd been taking for many years and then started the Synthroid not at the starting dose. The pharmacist attributed this error to that the prescription by the physician was illegible. So this is definitely an example of where this e-prescribing would prevent that error from happening. So some pros and cons from the patient perspective. So of course, there's fewer medication errors and fewer adverse drug events, improved patient safety. It's more convenient. Some of the cons is that, you do need to they might not be able to use the same pharmacy they've been using because they'll need to find one that does e-prescribe. Can be a little bit cumbersome trying to get controlled substances because usually those have to be done separately. And then, of course, privacy concerns with having electronic records. So from the clinician's perspective, some pros and cons. So the patient's medical history is readily available to them. It saves time. There's fewer medication errors. And then some of the cons is it might, with the current workflow, it might not necessarily fit. And then just problems with the software itself. You need to have IT staff. You could identify the wrong patient, just kind of different things that can happen within these electronic records. So looking at the cost-benefit analysis, so Ducker reported that in a study that over 12 months, they found that over $26,000 in 26,000 new prescriptions, on average, there was about a $4 lower average cost. So, and the reason for this being is that providers in real time are provided or get made aware of more cost-effective options. So also streamline processes, they can reduce healthcare costs. So for example, pharmacy spending a lot of time trying to decipher prescriptions, that's, that decreases productivity, increasing labor, things like that. Another thing that electronic prescribing has been shown to help with is primary medication non-adherence. So this is adherence from the patient to to do the first fill of a medication. So after they receive the prescription, filling the medication. So they found a 10% increase in the first fill of a medication when they looked at those using e-prescribing and those who were not. So looking at the different types of costs and how it relates to electronic prescribing, so fixed costs and variable costs. So with this, the fixed cost would be influenced by, because we would have to purchase this software, which can be expensive, and the training can be very expensive. And then the variable, the increased productivity would relate to the variable cost, increasing those. And then direct non-medical costs. So how this would be related would be, due to medical errors. So for example, if the wrong prescription is filled, then the patient needs to travel to the pharmacy again, and that's increasing cost and inconvenience to the patient. So indirect costs, so lack of productivity. So this would be time the pharmacist spends trying to decipher physician orders, and then related to the primary medical non-adherence. So if they spending the time filling prescriptions and then putting them back when they're not picked up. And then intangible costs, so these would be the costs related to pain or suffering, and so we could relate these to medication errors, and this would be not only to the patient, but it could be their family and those who are involved in the error. So for electronic health records, there's many software products available. You can do just prescription only, or you can do full medical record capabilities. I feel that if you're switching to electronic, I think it's best just to do the full electronic health record. I think there's many tools and things available that really help increase patient safety and have better outcomes. So Epic Care is one that's available. So kind of the perks is, so you have all the patient data in one location. So the providers have full access to their patient's medication history, all their allergies. They have full access to which medications are covered in the plan's formularies when they're prescribing it. And one study did find that it was over $845,000 in savings per 100,000 patients. There's also best practice advisories that alert providers of potential prescribing errors. So looking at kind of some of the benefits of this particular software within Epic. So looking at the patient experience, so it really gives patients the tools to be healthier. So they have, all of their personal information right available to them. They can message their doctors, they can do e-visits, schedule appointments, and it will also alert them of, health maintenance or things, kind of care gaps that need to be addressed, immunizations, things like that. So looking at revenue, so there's many different ways that this can really help maximize revenue. So it can, with online billing, it can really help with just speeding things up. It frees up staff time. And then kind of on the billing side of things, it can really help streamline everything just to make the cost more effective. So managed care, so it gives you the flexibility to support all lines of your business. So looking at the patient's insurance, making sure that there's claims are in premium billing, and there's portals for providers and member services, care management, utilization management, customer relationship management. So there's really just a lot of options in here to help making sure that you're getting the full benefit. So there's also very customized modules within Epic. So for example, cardiology has their whole own system that's tailored, very much for cardiology. So it really helps them with their workflow to be more productive and to really identify patient care gaps and things that their patients should be doing. So as I mentioned, they have best practice advisories. So this is one that could really influence costs. So what it does is, if there has been something ordered within a certain time period, it will alert you that this has been ordered. So then it will, can help save costs, because either it's two different physicians ordering it, or they didn't realize that it had been ordered. So it can really help save costs with unnecessary testing. Another helpful thing is that it will alert you if a patient has an allergy. So this order, they were trying to order IV contrast, and it's saying that this patient has an allergy to that. So there is an option for another smart set for mild allergies to give prednisone or Benadryl, or if it's severe, it's telling them that it's contraindicated. So implementation, so this is a really large undertaking. So I think that mixed method education modalities is the best way to go. Epic has many computer training based modules, so it would be specific to which care area they work in. So for example, clinic nurses versus inpatient nurses would have different things within Epic, so they'd have different training to do. And then after these have been completed, then there would be a classroom session where we would have champions. And these champions are people that work within our institution that received extra training through Epic. And then they are available to help teach our staff and help them work through learning this new system. When the system does go live, there would be staff readily available, so 24 hours a day. There'd be these champions available, so that if there's any issues that occur, then they can help them out, just to make this as seamless as possible. So with having an electronic health record, there's of course new challenges. So especially related to patient information safety. So there would be required that we'd have to do additional training each year to review how specifically to protect patient information with this new technology. So that talks about specifically making sure you're not sharing your passwords, logging out of your computer, not accessing charts that you don't have a reason to be in. So there will need to be policies implemented for this as well. So there's very clear expectations to the staff about which information they can be accessing and which they cannot. So in summary, implementing an electronic health record it's a very large investment. There'll be a large startup cost associated, but I really feel that the benefits offered from this type of system really do outweigh the risks. So the overtime benefits is there'll be cost saving through eprescribing, so access to the health plan formularies in real time, reduction of adverse events as well. Because of course, with any sort of adverse events, there can be a large cost associated with that. And then additionally, just being, I think we are, as healthcare professionals, are morally obligated to help reduce these kind of never events. So making sure that we're never giving the patient the wrong medication, the wrong dose, or causing them any harm.